Hello viewers, Assalamu alaikum. A unique feeling, a sense of fear, works within everyone, married men and women, that is, husbands and wives, as well as teenagers and adults, regarding their first sexual intercourse. Many people have various kinds of curiosities. Many wonder how they will do it for the first time, what they will do, what steps they will follow, or what method they will proceed with. Some even wonder if they will be able to do it at all, whether they are capable. They question themselves and their partner. What will their partner be like? Will their partner cooperate with them? In other words, will they both be on the same wavelength? These various questions inevitably stir curiosity and concern in everyone's mind about the first sexual encounter. And many people are scared and anxious about it, which can lead to a lack of self-confidence. Often they overthink it to the point of developing anxiety, which ultimately prevents them from enjoying the moment during their first time, causing them to become very agitated. I have previously released video messages on this topic, specifically about the first sexual intercourse. Today, I will primarily try to discuss what the research says. That is, I will attempt to highlight the issues that have been emphasized in studies conducted on first-time sexual intercourse. A study by the WHO states that the number of couples who do not use protection or do not ensure safe sex by using condoms during their first intercourse is the highest. As a result, since they are already anxious, if one partner is infected with a sexually transmitted disease, the chances of the other partner getting infected increase significantly. This highlights the importance of trying to ensure safe sex when you are with your partner for the first time. Another study published in the Journal of Sexual Medicine suggests that experiencing pain during the first sexual encounter is a very normal and natural phenomenon. In that case, one should focus on minimizing the pain. There is no need to be overly afraid of the pain. If there is mutual consent, and both are mentally and physically prepared, the pain will not be felt intensely. However, it's natural to feel a little discomfort when doing anything for the first time. This feeling is quite normal. So since experiencing mild pain the first time is normal, there is nothing to fear. Another study from the Journal of Adolescent Health states that if there is no prior mental preparation, consent, or communication, or if the mental and physical states are not ready, it can have a negative impact. Therefore, before the first intercourse, it is essential to be mentally, physically, and medically prepared. Regarding the health aspect, a study by the Guttmacher Institute suggests that both husband and wife should undergo some blood tests before their first sexual encounter. If they can get tested for sexually transmitted infections, the couple can be assured that there is no risk of transmitting any germs between them, allowing them to engage in intercourse without worry. These points should be kept in mind. There is another important study in the Archives of Sexual Behavior which states that during the first intercourse, both husband and wife must have empathy and a positive attitude towards each other. One should not hold any preconceived misconceptions or false ideas. We often have superstitions about certain things, and these baseless beliefs should be discarded and not be brought into the sexual experience. To put it more simply and openly, consent and self-confidence are crucial for the first time. There must be consent, there must be physical and mental preparation. One must have self-confidence and not be afraid. Curiosity is natural, as you are about to engage in something for the first time, but it should never become a source of anxiety. It's normal to have thoughts, but one must be careful that it doesn't turn into anxiety. Another important point, particularly for men, is the issue of the hymen or virginity. It is important to understand that a virginity test is a baseless examination. Therefore, you should never pressure your wife or partner about this during the first sexual encounter. Nothing should be done that causes her mental or physical distress. In other words, some discomfort or pain may be felt during the first time. In this case, before intercourse, you and your partner should try to find ways to make the experience more comfortable and pleasant. Various types of lubricant gels are available in the market, which, as we say, make the male penis and the female vagina more slippery, making intercourse easier. These can be used during sex. Again, I repeat, it is very normal to experience some pain during the first sexual encounter. Lubricants can be used in this case. They can help by making things slippery. The concept of the hymen or virginity is completely baseless. It is a violation of human rights. So try to avoid this issue or never be troubled by it. Another crucial point is that if there is no plan to have a child from the first intercourse, then using a condom is a must. This will ensure two things simultaneously. First, you can prevent an unwanted pregnancy, and second, you can prevent the transmission of sexually transmitted infections. In other words, you can avoid two issues at once. Another important aspect of first-time intercourse is cleanliness, both before and after the act. Both partners must maintain personal hygiene. Additionally, right after intercourse, it is important to be mindful of each other's feelings and physical and mental state. If someone is in pain, they should be given some time and shown empathy. If there is weakness, it is important to get some physical rest to feel better. In essence, you should learn about the potential problems you might face during your first intercourse beforehand and try to avoid them. This video message is primarily created so that those who are about to get married or are newlyweds can have a first sexual experience that is easy, joyful, painless, and safe. Today's video is mainly for them.